The problem we addressed in our proposal was that there are more and more adults with intellectual and developmental disabilities who are aging, and aging more quickly than the typical population does. And there's not enough accessible, affordable, high-quality housing in communities that are full of other seniors with access to vibrant cultural and recreational and therapeutic resources.
So our submission is we are going to build a brand new building, and it will be joining a campus where already slightly over 900 older adults live. And by adding another 80 or 90 older adults, we'll have about 1,000 people on this beautiful campus aging together in community, living full lives of connection and purpose in these dynamic supportive environments.
So one of the outcomes we expect to see is that the people with disabilities who are living in this community will not have the same level of loneliness they might have if they were living on their own in their own apartment. They have access to resources that they wouldn't normally have, and we feel that they will have a higher quality of life because they're part of this integrated community.
It's probably not a big leap of faith to say the building we're going to create here is going to be a lot nicer than the dilapidated, condemned building that we see in front of us.
Hi, my name is Ben Schutzman, and I'm the Director of Transportation Innovation at the MBTA. My submission's goal is to improve transportation access and mobility to constituents of the Commonwealth who are both elderly and disabled. The problem my proposal addresses is the RIDE, which is the paratransit service for the MBTA. The RIDE, just like many other paratransit services, has been a continual drain on budgets due to its ever-rising costs. In just the past 10 years alone, paratransit costs for the MBTA have increased from $50 million to over $100 million. And all while this has occurred, service for customers has not necessarily improved at the same rate. Our solution to this problem is an innovative, first-of-its-kind partnership with transit companies Uber and Lyft. The goal here was to both decrease the MBTA's cost per trip and also dramatically improve the customer's experience by giving them on-demand trips. This pilot was launched just about 8 months ago with the Governor and Secretary of Transportation, along with many other transportation and disability advocates. And in the past 8 months, we've been able to deliver over 20,000 trips to RIDE-eligible customers. We've had about 1,000 customers take a trip within the pilot, and compared to many transit industry averages for customer satisfaction, which are around 11%, this pilot's been about 79% satisfaction. And beyond some of the statistics, we've actually been able to hear really amazing stories from customers about their ability to get out of their houses, to go to work and make sure that they're always on time, and to be able to visit friends and family.
My name's Dave Weimer. I'm on the faculty here at the University of Wisconsin. My collaborator, Dr. Mark Sager, is a gerontologist who created the first inventory of adult children of Alzheimer's patients to study the environmental and genetic risk factors for the disease. Mark was also my neighbor. In our front yard discussions, I learned 3 things. First, although physicians weren't very enthusiastic about diagnosing Alzheimer's because they couldn't stop or reverse the disease, most patients want to know so they can be involved in the planning of the rest of their lives. Second, drugs can slow the progression somewhat. More importantly, caregiver support can enable families to keep their loved one home longer. Third, screening for Alzheimer's is relatively inexpensive. We've been delighted that Minnesota and Wisconsin have used our findings to create Alzheimer's screening programs. We hope other states will follow suit so that they can reduce the long-term costs of Alzheimer's treatment through their Medicaid programs.
My name is Doug Dixon. I'm board chair of ENCORE Boston Network. My entry is mobilizing talent of older adults to support critical government services. The problem that my proposal addressed it comes in three parts. One is that retirement itself is turning out to be dangerous and in some cases fatal. The second part of the problem has to do with the Department of Children and Family Services. The governor commissioned a task force and looked at some of the underlying issues. And what was found was that social workers and caseworkers were spending time in the office doing necessary administrative work, but not necessarily work that used their training and their skills to their highest value. The third challenge was that DCF, in looking to resolve that issue, doesn't have experience in bringing in volunteers to perform those administrative tasks. So the solution that we've proposed and have begun working on is to recruit older adults to perform many of the administrative tasks that will free up social workers and caseworkers to spend more time in the field. The result of that is not only do they themselves get out of the house, do something that makes a difference in someone else's life, but it also makes a difference in their lives. And of course, it makes a difference to the agency, which is better able to perform its role, its mission in the community.
Hello, my name is Sonia Rux, and I work with the Return to Community program. Our submission was about a service known as Return to Community, which assists private pay consumers who want to leave a nursing home and return to a community setting. I am accepting this award on behalf of the entire statewide service that assists people in all 87 counties. The service began back in 2010 and is provided through the Senior Linkage Line. The service is administered by the Minnesota Board on Aging and the area agencies on aging. The problem our proposal addressed is the fact that public and private costs of long-term care will increase dramatically in the future. Although nursing facilities are increasingly the source of Medicare post-acute care in the U.S., it is long-stay residents who account for the largest number of nursing home payments. This is because the far greater share of cost, both to the state and to the resident, if they stay, will result in spending down their savings and require enrollment into the Medicaid program. Since the program's creation in April of 2010, over 4,500 consumers have now been assisted back to the community from the nursing home. And we are proud to say that 260 of them were military veterans. 91% of Minnesota nursing homes have had a discharge through Return to Community during that same time frame. At 1 year of follow-up, 76% of individuals were alive and living in the community, and only a small percentage, 8.2%, had converted to Medicaid.